More than half of all Americans have gotten one shot of the COVID vaccine so far. That combined with the lowest COVID-19 case counts since last summer certainly points to a dramatic turnaround that we've seen when you compare it to Memorial Day weekend of last year. But the picture outside of the U.S. Certainly points to a different picture. Let's bring in Dr. Craig Spencer. He's emergency medicine physician and director of global health in emergency medicine at Columbia University. And doctor, this is something that you've been highlighting for some time. It does feel like increasingly there's a real divide between the progress we're seeing, especially in Western countries, versus other countries that are still waiting to get the ball rolling on the vaccinations.
Yeah, the pandemic has really split in two. There are wealthier countries like the United States that have been lucky to, buy up a bunch of vaccine and administer it to their population, leading to, in places like the US, Israel, the UK, plummeting case numbers, plummeting hospitalizations and deaths. This is great. You mentioned that 50% of the population has received a dose here. The US represents 4% of the world's population, but has now administered 16% of all vaccine doses administered around the world. Well, there are other countries that have yet to receive any doses at all. We've been saying, and it's more than just a cliche, we're not going to get this pandemic under control until we get it under control everywhere. We're seeing increasing worry that the variant that initially was first identified in India may be more transmissible. There's obviously the concern that as COVID is allowed to continue to spread around the world, more people will die, more variants may emerge. And I'm most concerned about the impact it's having on healthcare workers, 115,000 of which have already died from COVID, many of which won't see, many healthcare workers won't see a vaccine until 2022, maybe 2023 at this rate.
Yeah, I guess if there is one area of optimism to point to, it would be that about 50% drop from the peak in India's daily cases. And of course, there's questions around reporting there. But I mean, when you think about this as a global pandemic and where we're at in it, outside of that hot zone and where we're going globally, what's still kind of the risk that you could see this, given those low vaccination numbers, of another area popping up and leading a new wave?
Extremely high, and I expect it. Undoubtedly, we're going to have more places around the world that are going to be hit hard like India was. India has a population that is younger and more similar to places in sub-Saharan Africa, for example, that to date seem to have been relatively spared the worst of COVID. But that is no guarantee that they will continue as such. We've seen over the past year that some countries got hit really hard, others didn't, and we thought they were doing something special. And, months later, even up to a year later, those countries that did well at the beginning were hit hard. And this virus, I've seen it since really day one here in New York City, is mean, and it will infect anyone that it finds. And although the overwhelming majority of people do well, we've now seen that over 3 million people have died from COVID. Almost 600,000 here in the U.S. The toll will be much higher. In 2021, more people will die of COVID-19 than did in 2020. This pandemic is not over, even if it's increasingly feeling more so like that here in the U.S.
Even if the vaccine supply is distributed more evenly, we've seen a number of countries talk about the issue of staffing or hospital capacity, being able to vaccinate at such a rapid rate in the way the U.S. has. How do you address that part of the picture?
Yeah, that's a good question. Not every place is completely prepared for a Pfizer and Moderna vaccine. The logistics of it are indeed difficult, as we saw in December and January here in the U.S. But that being said, vaccines that need extremely cold temperatures, negative 50, negative 70 degrees, have been used in places like the Democratic Republic of Congo during an Ebola outbreak there a few years ago. There's certainly precedent for doing this in other places. And it may be that we can't vaccinate whole populations in the next few months or even the next few years, but we need to focus on the highest priority people, especially healthcare workers, especially those that are older. And I'm quite confident that many healthcare systems around the world that have a lot more experience in mass vaccination or, getting vaccines out through a public health network, through community clinics, could do this and could do this pretty well if only they had the doses and some more logistical support.
And, Doctor, when you're talking about risks to other areas, one of those areas right now that's kind of caught in a very interesting and precarious position would be Japan as they prepare for the Olympics there. And you think about rising case counts in a largely unvaccinated population. I mean,
Right.
it doesn't seem like it's setting up well, but what's your medical opinion on maybe what should be rethought there, and what kind of base case looks like for the medical component of the pandemic still ongoing?
Yeah, I mean, this is hard, right? We know that cases are going to continue to spread and are going to transmit around the world until we have enough people vaccinated. The Olympics have been a huge concern because of the risk that you'll have people from all over. They'll be mixing, the potential emergence of different variants. Look, I mean, for people who are vaccinated, for athletes and people themselves who are visiting or part of the Olympics, we know that being vaccinated protects you. And increasingly, we know that it protects you from infecting others, even if for some reason you do get infected. But we do need to think about some of the sacrifices that we've made over the past year, and whether we should continue to make some others in the interest of public health. For those who have been lucky enough to be vaccinated, like myself, one of the first people vaccinated here in the US as a healthcare worker, I'm really grateful for that. But the overwhelming majority of the global population is not yet and will not be anytime soon. And we need to consider them in our thoughts and our activities, and really how we kind of engage and emerge from the pandemic in the next few months and the next few years.
Yeah, and we've heard from the healthcare workers over in Japan saying, look, with just about 3 to 4% of the population inoculated so far, the Olympics should not be a priority. But we're less than 2 months out. We'll see how that transpires. Dr. Craig Spencer, always good to talk to you, emergency medicine physician and director of global health and emergency medicine at Columbia University.